You're good.
Okay, hello everyone and everybody on Zoom, welcome. Quick announcement, next week we have Luke Montrose for our seminar, but today it's my pleasure to introduce Emily Coyle. Emily is part of our PhD program and we will be hearing about a research update that she's working on for her dissertation. Take it away.
Thanks, Erin. Hi, everyone. It's great to see so many friendly faces. Like Erin said, my name is Emily Coyle. I'm in my, what feels like 20th year of my dissertation or my PhD program. Not that long, but it certainly feels like it sometimes. And what I want to talk to you today about is something that is an issue that's near and dear to my heart as the mother of two small children. But first, I want to take a minute and just reflect on the University of Montana's land acknowledgement statement. I believe you all have heard this and know it well, but just for the purposes of keeping it present in our minds, I'm going to recite it. The University of Montana resides on the traditional lands of many indigenous peoples, including the Salish, Kootenai, and Kalispel. Many other indigenous peoples, including the Blackfeet, Nez Perce, Shoshone, Bannock, and Coeur d'Alene also relied upon their traditional knowledge and relationships with this land and this space for survival in the past and today. We acknowledge that education, health, and legal systems have led to the direct removal, oppression, and marginalization of indigenous people throughout Montana and the nation. The University of Montana strives to improve education, service, and scholarship for all indigenous peoples through actions aimed at respecting tribal sovereignty, empowering indigenous scholars, and creating safe learning environments for all students to live, work, and learn together in equitable and positive ways. And I just want to acknowledge also that it is my goal to raise my kids in a way that's respectful of the people who have been here and continue to be here, and to do any research that I do in partnership with indigenous people. So I'll give you a quick overview of my presentation. I'll be talking a little bit about my research interests and the dissertation proposal. And then I'm going to dive into some background around PM 2.5, wildfire smoke, and children's health. And specifically, there's three main areas I want to look at. The socioeconomic characteristics and vulnerability, risk communication and behavior change in this area, and something that has become more and more popular over the past several years is vulnerability indices and how they relate to wildfire smoke and other planning and public health and disaster efforts. Then I'll walk through each of my aims individually and go through next steps. So these are my kids. This was a smoky day last year in Missoula. It was in September, and I had to make this decision about, do I let my kids outside so they can run around and be normal kids, or do I keep them inside and we all go a little bit nuts? Because kids need to be outside, and that's just a reality of being human. And in one of these days, I had to make this choice when I went out for a run and I had my daughter in a stroller, because pandemic, no childcare. This is what you do when you are raising children through a pandemic. And I knew that maybe it wasn't a great idea for me to be running. Maybe I was going to be, inhaling a little bit of PM 2.5. But we were just at that threshold where it wasn't bad enough to be really bad. But I thought to myself, well, my kid, my baby, is going to be exposed at some level. And I know that she's more susceptible, but how much more susceptible? And like, how much is too much smoke? How much is actually going to have an effect? And I really didn't know how to answer that question. And I don't think I'm the only person who has that question when they're bringing their kids outside or when they're making that decision. So what I started to think about is, how much do we know about how bad smoke is for ourselves and for our kids? And where are the gaps in knowledge in this area? What causes some people and not others to reduce their exposure or change their behavior to mitigate, the health impacts? And finally, is there a way that we can incorporate multiple data sets into a single tool to support providers, public health, parents, and other stakeholders in evaluating risks and mitigating exposure to wildfire smoke. So a little bit of background here. This is not going to be a surprise to any of you. More than 7 million children in the US are exposed to potentially harmful levels of wildfire smoke, particulate matter each year. Wildfire smoke exposure has been shown to weaken children's immune system. Young children are at increased risk of bronchiolitis, bronchitis, pneumonia, and exacerbations of pre-existing asthma. Children under 5 years of age are at increased risk of respiratory visits and asthma hospitalizations within 3 days of wildfire smoke exposure. We know that in utero exposure leads to preterm birth and low birth weight. And also there's a study from, I think it was Australia, about in utero exposure from a cold fire led to respiratory effects up to 4 years after exposure. So we're seeing these short-term acute effects and more long-term chronic effects from PM 2.5 exposure. And we also know that this problem isn't going to go away. It's only going to get worse. A recent study showed that area burned by wildfires will more than double over the next 3 decades compared to the previous 30 years. So this is our reality. This is our new reality that we are going to be raising our kids in and practicing public health in and needing to prepare our healthcare system to address the impacts of wildfire smoke exposure. So I want to talk a little bit about wildfire smoke and health disparities. So this is a picture of the Elmo fire from 2022 that the city of Polson took up on the Flathead Reservation. And what we know from the literature, and there's really no argument about this anymore, is that there's a strong relationship between the health of individuals and the social, demographic, and economic characteristics of where they live. So this was in a review paper because I couldn't cite all the sources that can say that. We also know that social determinants of health are linked to poor health outcomes at the individual level. So, you know, you've heard the term, your zip code is more, you know, is a better indicator of your health than your health, right? Or, you know, your age or other factors. So that's very true when it comes to health disparities as well. So what we're seeing now is that wildfire smoke may pose a disproportionate risk to individuals with lower income, education, and access to care, as well as to some racial groups. And then we also know that there's some spatial temporal variability in PM 2.5 concentrations from wildfire smoke. So, you know, we see inversion events here in Missoula, for example. You know, we have valley bottoms where smoke can settle. And this can happen across a relatively small geography, as Alan Swanson and Aaron and their team have shown recently in a paper. So those are just some of the factors that I'm considering as I move forward. And then if you look at exposure risk and behavior change, so there are some studies on exposure risk among adults. There's not a ton, but there's even fewer among pregnant people and parents of small children. So we don't really know about how effective wildfire smoke exposure risk communication is in terms of promoting behavior change among pregnant people and parents and caregivers of small children. And there's a lot of barriers that exist in effectively communicating those risks associated with smoke exposure across all populations. So some of those are, you know, mistrust of the messenger, could be inconsistency in the sources from which they receive the information, health literacy, could be language barriers, all sorts of different factors that are documented. And additionally, social vulnerability could impact whether and how individuals adapt behavior. So, for example, if there's low access to resources or information based on your socioeconomic status. So moving over to discussing a little bit more about how this all kind of fits into where I'm going. You may have heard of vulnerability indices or a vulnerability index or a health index or you know, environmental justice index. There's a bunch of them. But according to the United Nations Office for Disaster Risk Reduction, they define vulnerability as the conditions determined by physical, social, economic, and environmental factors or processes which increase the susceptibility of an individual, a community, assets, or systems to the impacts of hazards. It includes really risk and response variables. So I want to give you, I'm going to walk through a few examples of risk of indexes, I guess, vulnerability indexes. So this first one is the CDC's social vulnerability index. This has been around for a while. They rate vulnerability on a scale from 0 to 1, 0 being the lowest vulnerability and 1 being the highest vulnerability. And they have calculated all of this. Let me just make sure I've got the, I think it's at the zip census tract, okay, so at the census tract level, all this information is available at census tract level and county level. And they look at 4 main categories: socioeconomic status of the folks in that census tract or county, the household characteristics, racial ethnic minority status, and housing type and transportation. And they can get all this stuff. It's all publicly available, American Community Survey, pretty easy to access. So that's one. Another one is the EPA's Community Health Vulnerability Index. And this one came out, I think, in 2017, and I actually can't find it online anymore, so I don't know what they're doing with it or if it's been updated. But when it did come out, they took it a step farther, and they indexed the health vulnerability to smoke exposure based on previously reported factors. So they were looking specifically at pediatric and adult asthma, COPD, obesity, diabetes, hypertension, percentage of the population that was over 65, income, education, poverty, and unemployment. And this is all at the county level. So it's not super granular. And we know that counties can be, huge, and population indicators vary greatly among geographic areas. So it's also, the data sources are also from the Behavioral Risk Factor Surveillance System, the American Lung Association. So, these are small area estimates. They're not 100% accurate. But still a really cool tool for planning purposes, especially for public health agencies. And then finally, this is one that I really like. This is from Oregon State University. Their Department of Forestry created the wildfire risk vulnerability map. And on the left side, they've got all those social vulnerability indicators that we've discussed, the CDC has used. So you're looking at, again, housing and transportation, minority status, household composition, disability, and socioeconomic status. And then on the right side, so all of those factors add up to social vulnerability. On the right side, you have their estimation of wildfire likelihood plus their estimation of wildfire intensity, and they calculate a wildfire risk score out of that. And those two categories, themes together, comprise their overall community vulnerability index. This is also recently been taken down from their website due to some political considerations with people realizing this is just an aside, that perhaps, insurance companies were going to start to consider where their houses are located and devalue their homes. So it's just one thing to be aware of. They're talking about health and property values, which is, to me, it's just an interesting little piece of information that we need to consider in public health when we're doing these types of things, is what's the full scope of how and who we can impact. So moving forward, all of that said, that's really the background. My dissertation proposal is going to take the form of an explanatory sequential mixed methods design. What that essentially means is I'm going to collect data in 2 consecutive phases. So the first phase is going to be a survey that I'm going to conduct among parents and caregivers of small children and people who were pregnant during the past wildfire smoke event. This survey is going to inform the next phase. So my aim 2, which is going to be the qualitative interviews. And those are really going to serve to build on the data that I derive, that I receive from analyzing the quantitative survey, and provide some more nuance, kind of like the why, a little bit deeper than the what that we're getting out of the quantitative. I'm going to develop the themes based on, the next slide. This is also called an integration approach, which is connecting and building. Connecting is the quantitative, where you're identifying the different themes that are going to appear. And then the building part of this is where you elaborate more on those themes to get to some more in-depth information on what you're exploring. And my ultimate goal is to create a children's health and social vulnerability index that takes into account these social factors, socioeconomic factors, health factors. So we have access to hospital records that can show us at the zip code level where are there existing disproportionate numbers of emergency department visits. So where are kids living who may have a higher propensity to visit the ED? There's a lot of modifying and confounding factors, I think, there, considering that some folks with lower economic status may not seek care. So that's another question that we're going to have to address, I think. And perhaps other health effects. And then PM 2.5 potential. So this is out of Dr. Landguth's and Alan Swanson's paper, where they really looked at what is the potential for PM 2.5 exposure in a particular area, given the topographic and terrain factors that are really static in that area. So not how much smoke is passing through, but what's the likelihood of smoke to be worse there than in 1 kilometer over. And then finally, that qualitative mixed methods piece, where hopefully I'll be able to create kind of like a score out of the quantitative and the qualitative data integrated. And then what you can, I'll move on. I'm not going to get too much into it. So the first aim, again, as I talked about a little bit earlier, is to identify the extent to which caregivers of small children and pregnant people adapt behavior to reduce children's exposure to wildfire smoke. So like I said, we'll do an online survey. I plan to pilot test it and do revisions before we actually disseminate the survey. We'll distribute the survey through social media, daycares, the home visiting program. We're still in the process of really identifying our recruitment strategy. And the selection or inclusion criteria will include being a parent or caregiver of a child 5 years of age or younger, and or pregnant during the most recent wildfire smoke event, being a Missoula County resident, and some other criteria to be determined. So under that question, there's really 3 main categories that I want to try to address. Specifically, in response to behavioral response to wildfire smoke exposure, how are sociodemographic characteristics associated with that? And then I'll break that into healthcare. What kind of healthcare do they receive? What kind of payer is covering? Are they private pay? Are they Medicaid? And then what are some socioeconomic variables that are associated with that particular theme? The next question that I want to answer is, how are health effects or symptoms associated with behavioral response? So we'll look at existing health conditions and or when people actually do have that exposure, what are their symptoms? How are they responding? And how does that affect outdoor recreation and other activities? And then the final area is what's the impact of air quality notifications and messaging on behavioral response? So how is the information being disseminated? How is it being received? How aware are people, from different, backgrounds and socioeconomic factors, really interpreting that, and what's their response to the information they're receiving? What's their decision-making process? So some of these questions are hopefully will be elicited from that first aim. The second aim is to identify barriers and facilitators to reducing wildfire smoke exposure among pregnant people and parents of small children. So my goal here is to do a minimum of 12 semi-structured interviews, maybe up to 20, 25, depending on the data that we get from the survey. It'll be a purposeful selection of questionnaire respondents from multiple categories such as income, geography, health status, race and ethnicity, and maybe some other variables that emerge from the quantitative. And again, I'm not gonna do 12 more interviews, so that's a typo, should not have that third line there. And then my third aim is to develop that community-specific children's health and social vulnerability index. So the first step is to integrate the results from aims 1 and 2. One method of doing this that appeals to me is through a joint display, which is it's a visual means to draw out new insights beyond the information gained from the separate quantitative and qualitative results. This really can help visualize how the interview results validate the statistical analysis of the quantitative survey. So what's cool about this is, you can have more explanation of these themes. So by adding quotes to really explain a little bit more about where these themes are coming from, which I really like, value of mixed methods. So finally, this is a conceptual model of the Children's Health and Social Vulnerability Index. And this is all in concept form right now, but the goal is to take what we have here already in Missoula in terms of an SVI. The Singularity's Adaptive Capacity Index is very similar to a social vulnerability index. And then we have how do these variables impact health status? So this is going to be the hospital data where we can see emergency department visits and hospital admissions. And then we look at behavior change over here, which is going to come from those aims 1 and aim 2 integrated. And these, so my theory is that these two variables will affect each other, or will have some kind of relationship in a bidirectional way. So I could be wrong, but I'm thinking that, health may affect behavior, behavior may affect what your health is going to look like. Maybe behavior for past wildfire smoke events leads to you being, if you did not try to avoid the wildfire, last year when you were pregnant, your kid's unhealthy now, and you recognize that. So who knows? There's a lot of nuance in this. And then the smog, or the smog potential, or PM 2.5 potential, that's that static variable, could potentially impact behavior change, and then could also impact health status. And then the SVI could also impact behavior change. So this is just all concept, lots of thinking to do on this still, but all of that together would hopefully lead to an overall index that takes all those categories, all those factors into consideration. So the why of this, when I was looking at the literature, one thing that became very clear was that most of these vulnerability indexes focus on socioeconomic vulnerability. Few actually include health indicators, such as non-communicable diseases, maternal mortality, vaccine coverage, blood pressure, again, hospital discharge data. And if they do include health data, it's usually from from like the BRFSS or some other kind of imprecise data collection method, and definitely not at the zip code level. So this is not something that's super common yet, and it certainly doesn't exist around children in wildfire smoke exposure. One comment that was interesting to me that I don't know that we'll be able to get to in this particular survey, but what is the level to which healthcare professionals speak to their kids or to parents about the risk of exposure? So there are some who are going to be speaking about it regularly. Others maybe not. And we know that there's methods to try to remind physicians and providers, like electronic medical alerts, but there's also a lot of variables that go into that not being a great solution either, because there's alert fatigue, right? So if you're getting all these alerts about all these things that you have to remind parents about in a 15-minute sports physical or 15-minute, well child checkup, that is just something that we're not 100% sure is going to be the solution. So I think there needs to be a multifaceted approach. You need to be including public health, you need to be including providers, you need to be including parents and academia, and answering these questions of how to promote resilience among kids and reduce their exposure to wildfire smoke. And as I said earlier, the survey and interview data analysis and input can provide more nuanced information to help answer those questions and identify the why of behaviors to better customize any future interventions or additional research. So the next steps, my goal is to finalize and pilot test the survey in April and May. We've got a pretty good draft, I think. Right now, I'm looking at analyzing the survey results May through June and using those results to inform the key informant interview instruments in May and through May and July, and conduct interviews shortly thereafter. And then I went a little bit, I talk really fast. I think I've mentioned this to some of you. I did win speaker points in debate in high school. I never won a debate, but I could talk fast, so that got me points. I just want to thank Dr. Landgraf, Dr. Belcourt, and Dr. Kringy, Dr. Noonan, and Dr. Simmons for sticking with me through this very long and arduous process and all your support and expertise. So, thanks. Erin.
Thanks, Emily. So I have a question about moving from Ames 1 and 2 to Ames 3. And if you see Ames 1 and 2 as actually contributing to the index, like being part of it, like so, and how does that happen kind of practically? And or do you see Ames 1 and 2 informing the interventions that would be applied to the more at-risk communities?
So, I mean, I think either could be, so in my, so my proposal is going to be the Ames 1 and 2 contribute to the index itself. And the way, there's a few ways that you can do this that I've read about, and there are greater minds than I in this room who can probably provide even better examples. One of which is you can take the kind of that primary data, that qualitative data, the interview data, the survey data, which is quantitative, integrated this all together into themes that you then can create kind of numeric, like a numeric score for. So it's not precise, and it takes kind of like an iterative process, but you can incorporate qualitative data into a quantitative model that way. And that's something that I haven't seen done in these indexes, so it may just be a complete failure, but my hope is that, identifying levels of kind of vulnerability within the answers that people give to, like, for example, I would say, so I'll give you an example. So if I'm asking a mom, would you leave would you take your family and leave if there's a big wildfire smoke event and it's going to be dangerous? And they say no. So that's yes, no, right? That's 1-0. And then if I dive even deeper in that discussion and I say, so why is it that you wouldn't leave? And they say, well, maybe one of two things. Well, I just don't want to leave, right? Or I can't afford to leave. So I would probably place greater weight in terms of being more vulnerable on I can't afford to leave. Does that make sense?
Yeah, I feel like I'm still sort of looking for that like spatial link almost, like if the index is.
Sorry, I'm hoping to ask people for their zip codes too.
Okay, so like a zip code.
Yeah,
Okay.
sorry.
Yeah.
Left that small minor detail out. That's a very big part of my project.
Oh, that's great. Thank you.
Yeah. Curtis.
Yeah, so great presentation. Thank you, Emily. I just have a similar line of questioning on this. Maybe would you mind going back to I just would like to see the circles and arrows thing. If that would help me. Yeah. So the index, I mean, you think like in the way that, say, Oregon State presented the index, it's just a static thing.
Yep.
If you live here, this is your risk, right?
Mm-hmm.
And so again, like the behavior change, that seems to be an individual level thing. So does that mean that the static index is going to be sort of weighted by what you presume to be the behaviors of a particular like geographic area? Or is it going to be that people can input their behaviors into this index interface and then that would yield a different kind of result? Like which way do you, or is it neither of those?
So I don't know that in terms of, I don't know that it's gonna be quite so static. So so my question really is, how much is this gonna, I mean, overall, like, how much is this going to impact all these other, like, how much of an impact is it gonna have? Right, on the overall score. So honestly, Curtis, I don't know yet if it's gonna be like you input more data or you just say, hey, if, you know, these are the variables that contribute to somebody's behavior, do you need to take a closer look at these other factors? It's still all conceptual.
Yeah.
Jim?
Yeah, nice job.
Thanks.
So I apologize if I missed this. You said that, I think I saw on your slide that it was gonna be a purposive sample.
Yeah.
That you're gonna use for your 12 qualitative interviews.
Mhm.
What are the elements that you're gonna consider to make up that sample?
So I'm gonna look at, here, let me go back to that real quick. See what it actually is. So I'm hoping that I'm gonna have categories that are gonna come out of the survey. So themes, right? So and then how do people fall under those themes? Where are people falling in terms of their income? How does income differentiate where they, like, how they're answering? How does geography, where they live, how is that influencing their answers to the survey? What's their health status and how does that influence? And then race, ethnicity, those types of things. I'm still in the process of exploring what are those specific variables going to be. And I'm not sure, you know, in the survey right now, it's kind of broken out into these broader categories too.
Mhm.
So does that answer? I mean, I want to make sure that I am being purposeful about including the broadest range, really incorporating all the demographic variables from that of the respondents. So what that's also going to mean is making sure that the survey goes to a variety of populations, right?
Thank
Is
you.
that right? I mean, am I on the right track?
Yeah.
Okay, thanks.
That's a track you could go.
Okay.
Yeah,
Thanks.
yeah, I think it's, you know, just having your rationale. Like we
Okay,
talked about,
yeah.
complicated, so
Okay, good.
Yeah.
Thank you.
you got it.
On the quantitative side, it looks really like your sampling approach is very convenience based. So I'm wondering what strategies you're going to try to use to minimize your selection bias and make sure that you get a true cross section.
Yeah, that's a great question. I mean, we have what, like 5,000 kids under the age of 5 in Missoula County, right? So I've got to make a lot of assumptions. I've got to make an assumption that most of them are in daycare. There's a few things. So I think there is going to be some self-selection. I think there's going to be selection bias. I think it's going to be unavoidable in some cases. But what I'm going to try to do when I'm looking at, you know, targeting the, you know, where I'm recruiting folks from is identifying maybe higher cost daycares and more lower cost daycares. I may be trying to, you know, recruit through social media, asking kind of, you know, a little bit more, I mean, it could be more pointed and just saying, you know, if you struggle in this area, you know, or if you identify as somebody with, you know, socioeconomic challenges, you know, I encourage you to to complete the survey, but that is something that I don't have the answer for yet. I'm just kind of casting a wide net and hoping that I get answers right now. Carrie?
How long does your survey take parents to fill out?
So the hope is like 15 minutes. I mean, and the survey it's gonna be multiple choice or yes, no, intentionally.
Thanks.
Claire?
This is a really interesting topic. I think it was one of your first slides where you were talking about the importance of physical activity and getting kids outside and things like that. And I was just wondering if you have a sense of the magnitude of the impact of not getting physical activity versus exposure to wildfire smoke, or if there's any way to account for that.
That's a great point, and all I have is anecdotal from personal experience and just from what I've heard people say. And I mean, that's a really great question and something that I didn't consider, and I'm going to add that to my notes. So thanks. Tony?
So what is the final product? Then like who's the end user?
So there's going to be a few final products, right? So 1, 2. So I'm going to have a paper on the survey that I hope to submit. Really, this what to what extent do caregivers of small children, pregnant people adapt behavior? The second is going to be the qualitative, the publication using kind of the barriers and facilitators. And the third is the idea of an index. So whether it's interactive, ideally it'll be a map of zip code level information on that'll incorporate, hold on, let me go back to this. So the social vulnerability score plus a health status score, vulnerability score, the behavior change score, and a smog score, all into like a 0 to 1 maybe, right? That'll show at the zip code level, you know, a spatial map with kind of a overall vulnerability score from 0 to 1. That's the idea right now. It may change. For Missoula County.
Missoula County.
Yes. Well, and then so Missoula County will only so Missoula County will be the one that includes the behavior change. There will be a broader statewide map with all this at zip code level with kind of these 3 factors that are going to be in a final vulnerability score, have a final vulnerability score across the state for each zip code.
And then who uses this?
That's a great question. My hope, maybe somebody uses it to develop something better. Maybe we show it to providers, maybe we show it to public health agencies. I think there's a lot of, you know, and that's a really good question because one of my questions is how often are these types of indices used? And I couldn't find a whole lot of information on that in the literature. Everybody likes to make them, but the practicality of them is another issue. So whether or not it's going to be used is one question. Who could use it? Theoretically, I'd love to see it being used by public health planners, disaster preparedness officials, healthcare providers. I mean, the reality is, and I think this varies from provider to provider, but do they know the extent to which their patients are vulnerable, right? And if you can show them that, you know, some of the reasons that they may or may not take action can influence how they speak to their patients or their parents' patients. I mean, that in and of itself could be, you know, a systemic change.
I guess one more question about
Yeah.
the behavior change. Is that like, what do you mean by that? Like, whose behavior change?
So the behavior change, hold on. So what are parents doing to keep their kids indoors? Are they reducing outdoor exposure during wildfire smoke events? Are they using air filters? Are they using masks or respirators? Are they leaving the area Are they, taking medications, or are they seeing the doctor in response to conditions that could make them more vulnerable, any number of behaviors that could impact the kids' exposure level. So for the parents, for the pregnant people, it need their own behavior, and for the parents of small children, it'll be what are they doing to take steps to mitigate exposure for their kids. I mean, for example, if somebody, one of the questions could be, are you keeping your kid home from daycare because you don't think your daycare is providing enough filtration, or, they're not keeping them in, who knows? I mean, it's just, it could be something as simple as that. It could be, are you sending your kid to daycare now because, that their air is clean and they have opportunities to recreate and exercise indoors? Or are you going to the gym, instead of working out outside, or taking your kids to play, at an indoor facility? Does that answer your question?
Yeah, and I'm just thinking, I remember something there that during COVID, like evaluating different interventions. Let's say everybody wore a mask, or everybody did whatever, and you would show like how illness and death was corresponded over time. Like if you could, evaluate like different types of interventions using that behavior change input.
It's great. Yeah. And I'm glad this is being recorded, because I am not taking notes, and I'm really liking the ideas that I'm hearing. So thank you.
Emily, thanks for your presentation. I just want to say it's really inspiring to see a parent with young children taking on a project like this. It's just, as a mom, it's really inspiring. So thank you. I was curious with the timeline of your question of your interviews and of your quantitative study. Does it coincide with wildfire smoke season? Or?
Hopefully not. We need preliminary results by June-ish. So probably not. And I've really been going back and forth on that too, is am I asking about a specific date, right? Like the last wildfire smoke event, or am I asking broadly in general terms? What do you do? I'm almost more interested at this point in asking about what they can recall from a recent wildfire smoke event, and then asking now, are they, maybe we'll see if there's any change in what are they going to do differently, because I am asking kind of those retrospective questions and those prospective questions in the survey. So what did you do? What are you going to do? Does that answer your question?
Yeah.
Can't see anyone online. If there's questions for online, we could look really quick. If there's any questions online.
Nothing in the chat.
Okay. Well, thank you, Emily.
Thanks.
All right,
Oh.
no, just a statement. Where do you go,
Okay.
Emily?